The Ministry of Health would like to inform the general public that Uganda has confirmed her first case of coronavirus disease, COVID-19. The confirmed case is a 36-year-old Ugandan male who arrived from Dubai today morning, Saturday 21st March, at 2 a.m. aboard Ethiopian Airlines. During the screening process at the airport, his temperature was 38.7 degrees centigrade. This prompted the health teams at the airport to isolate him for further follow-up. Subsequent temperatures taken at intervals of 30 minutes and 1 hour remained the same. He was evacuated to Entebbe Grade B for further follow-up, where a nasal swab was taken for analysis. The confirmed case presented with high fever and poor appetite. He is not coughing, neither does he have flu. However, the persistent fever prompted the health workers to isolate him. His nasal swab was sent to Uganda Virus Research Institute for analysis. Results from Uganda Virus Research Institute showed that the sample is positive for COVID-19. The confirmed case had traveled to Dubai on the 17th of March 2020, that's 4 days ago, for business purposes. At the time of his travel, he was in good health. He is a resident of Chibuli, Kakungulu Zone in Kampala. Currently, he is still under isolation at Entebbe Grade B. He remains in a stable condition, but still running a fever. The Ministry of Health reassures the general public that all measures were undertaken to identify this case at the airport and isolate him in a timely manner. The passenger manifest has been retrieved, and all contacts are known, as the passports of the travelers on this plane were retained at immigration, and all the travelers were put under quarantine. To date, Uganda has a total of 1,827 travelers, including Ugandans and others traveling back home, under self-quarantine and institutional quarantine. 827 who are under self-quarantine will be completing their self-quarantine in the next 5 days. 1,000 are under institutional quarantine. The public is hereby requested to remain calm and vigilant, and to report any suspected cases or call our toll-free lines on 0800 203 033 or 0800 100 066, or the following officers: Mr. Tek Kajirita on 0782 909 153, Dr. Alan Muruta 0772 460 297. I thank you. The concerns that the Ministry of Health may not have capacity to handle the number of cases depends on how quickly we detect and how quickly we manage. If cases are left to go out, that is when you get worried, when they've had contact with one another. But I want to applaud my teams that they were quite vigilant, and they got this case and also got all the other travelers because they have their passports. So that is a plus to the teams who are at the airport for a job well done. So all we need to do now is to round up all these people, see those who have signs and symptoms, get them screened, quarantine them, and follow them up, which is being done very well. So I must say that in one way, this was good, because then we don't have to go into the communities to look for who the gentleman could have had contact with. The issue of the Chinese who were removed from quarantine in Naguru and moved to another area was because the population in Naguru did not want them there. We are having challenges with the majority of the population exhibiting some form of stigma against some people. And so the issue of quarantine becomes a bit of a challenge every time we have passengers traveling in. But we continue to sensitize them, because people under quarantine are not necessarily sick people. They don't have symptoms, they are healthy. So they are not a threat as long as they remain in their rooms. And if they develop any signs and symptoms, then we quickly evacuate them and disinfect the rooms. So we'll continue to sensitize the population to understand this. Now, the issue of many people still traveling into the country will no longer arise, because His Excellency the President this evening issued additional directives to his previous directives that were given on Wednesday. The airport has been closed, and the closure will take effect from midnight tomorrow. So no passenger planes will be received at the airport except cargo planes. So that means we will no longer be receiving passengers coming from any country into Uganda. Similarly, no passengers will be crossing on road, because the borders as well have been closed to all passengers except cargo. So that gives us opportunity to concentrate on those that are under quarantine in the country. For those who have signs and symptoms of cough and flu, they need to stay at home. But even while they are staying at home, we encourage them to report so that we can evaluate them and have them tested, just like we have been doing. The 100 tests have been from alerts that we have been receiving from people who develop signs and symptoms of flu and cough, and we have been doing this, removing and analyzing as frequently as possible. Self-quarantine was not working. Many Ugandans were abusing the system. They would move out of their homes and go to various places. When our teams went on the ground to follow them up, they wouldn't be there. Even some other nationals other than Ugandans were doing the same. And so we concluded that self-quarantine was not working and it wasn't effective. However, we have continued to monitor them, and as I said, the majority will be completing their 14 days self-quarantine. Now, moving on to institutional quarantine, again, it has proved not effective for several reasons. Many of the travelers are not willing to pay for their accommodation and meals. Two, even when they are able to pay for their accommodation and meals, they keep on walking out of the hotel rooms. But of course, because there is security, they stay within the vicinity of the hotel. Thirdly, there is a lot of complaint and unrest within the areas. And to address that issue, our president today stopped any more flights, because we cannot take in any more people who are not willing to undergo a quarantine. So moving forward, we will monitor those who are already under quarantine until they complete their 14 days. From the outset, Uganda was very clear that if you decide to travel into the country, you will meet the costs of your quarantine. But to see people coming in and refusing to meet the costs of their quarantine is very unfortunate. The majority of the people coming in among these travelers are from the Category 1 countries, including China. And we will encourage them to complete their quarantine. However, those who are not willing to complete quarantine, their countries can organize and evacuate them if they can. But from midnight tomorrow, the airport is closed. Regarding the Chinese nationals who tried to escape, and they will face the courts of law accordingly. In any case, they only had entry permits into Uganda and not for the DRC where they intended to go. And so this will be addressed according to the laws of the land. Regarding testing centers in rural areas, we are aware that the test kits in the US has been approved by the FDA. We are yet to receive information from the World Health Organization whether they have concluded evaluation and whether countries can now access these tests and use them if they have been standardized. As soon as that information comes through, Uganda will procure the rapid tests and deploy them in the various areas across the country. We are also considering bringing in the antibody tests as soon as the World Health Organization allows or approves its use to the various countries.
As we end today, 21st, we have received such a case. And therefore mine is just to encourage Ugandans to stay calm and to use the advice given by the Ministry of Health, and also to adhere to the directives given by the President. All of this is done in our good faith. We all want to live. Fellow Ugandans, we need to tighten our belts, because the problem that we have been seeing from far is now knocking on our door, and we have to really we have to put our feet down and say we have to survive this scourge. We had at least taken some days before we get it. I also want to encourage fellow Ugandans who wanted to go out and do business, despite the fact that we have closed the borders. And this was our first advice on the onset. You realize that this young man left Uganda the other day on 17th, and now he comes back with a problem from Dubai. So I want to encourage our people to stay calm. Our government is in charge, and we know that the Ministry of Health officials are really going to help calm the situation. With the prayers that we had today, I definitely know that God is on our side. Thank you so much.